Hi, today I'm going to tell you about insulin. So first I'm going to tell you about Humulin N and Humulin R, then about Humulin R. So in the hospital setting, there has been a lot of medical med errors due to wrong doses of insulin. So even the students are getting these questions wrong in their testing time. So I'm just going to give a brief introduction of Humulin N. So Humulin N is usually twice a day, once before breakfast and another one is after bedtime at HS and AC. And then I'm going to talk about Humulin R, sorry about that. So Humulin R, it depends upon the doctor's order. It can be twice a day, which is BID. It can be thrice a day, which is TID. It can be 4 times a day, which is QID. So we have to measure the glucose level before giving this Humulin R to a patient. The Humulin N is usually scheduled by doctor, so we can just go to the MAR sheet and we can just give this medication. And for Humulin R, as it is a short-acting medication, it will act shortly within 30 minutes. So we need to glucose the blood glucose level before giving this medication, and for that we need to have a look at the sliding scale as per provided by the doctor. So that is all about the Humulin N and Humulin R. And now I'm going to just give you a scenario or a situation where I will explain you how to give insulin as per doctor's order. So, as I said, we need to monitor the blood sugar 4 times a day. And so my first question is, so at 700R, I measured a patient's blood glucose level and the blood glucose level was 16.6. So according to that, how much dose of glucose, Humulin N and R would you give to the patient? So, according to the doctor's order, the Humulin N has to be given at a breakfast, AC breakfast, that's 25 units. So there goes 25 units. And then the blood glucose level is 16.6. So according to the sliding scale, we will give 17 units of Humulin R. So for a total, we will give 42 units of insulin, a combination of Humulin N and R to the patient. And now, my next scenario is at 11:30. So at 11:30, a patient's blood glucose level is 6.2. So what dose am I supposed to give to my patient? So at this time, Humulin N is 0 because as per doctor's order, it was only, we were supposed to administer it at breakfast time and at a bedtime. So we are not supposed to give any Humulin N at this point. And Humulin R has to be given 5 units because the blood glucose level was 6.2. So we will not give Humulin N here. So just 5 units of Humulin R at this point. And then at 17:30, my patient's blood glucose level was 5.2. So at this point, as per doctor's order, we have to check patient's blood glucose 4 times. So at this point, we are not supposed to give Humulin N. As I explained earlier, it's only twice at the breakfast time and at the bedtime. But the blood glucose level at this point is 5.2. So I will give Humulin R as per sliding scale, which is 5 units. So I'm giving total of 5 units of Humulin R to my patient. And now the time is bedtime. Another time is 21:30 at the bedtime. Usually we as the nurses and students, we are confused with the bedtime. The bedtime is not 17:30, it's a dinner time. So we need to focus at this time, which is 21:30, that is considered to be the bedtime for a patient, not 17:30. So at 21:30, the blood glucose level was 6.7. At this point, as per doctor's order, I will give Humulin N to my patient that is 12 units as per doctor's order. Right there. So it's 12 units at XS bedtime. And the Humulin R as per sliding scale will be 11 units. So we are giving total a combination of Humulin N and R 23 units. Okay, so I'm going to tell you how to fill in a syringe. So as per the rules, we are supposed to fill clear to cloudy. So the clear one is Humulin R and the cloudy one is Humulin N. So first I'm going to use a pink color for Humulin R. So we will fill a clear solution first, that's Humulin R. So it is 11 units. So I will use 11 units here. So it's 10 and 1. So there it goes, 11 units. And this is Humulin R. And then there has to be total of 23 units. And now I will fill in my cloudy solution, that's Humulin N. So it is, I'm going to represent it with the blue color. So it has to be 23. So it's 20, 21, 22, and 23. There you go. And here's 23 units of a combination of R plus N Humulin. So that's how we administer Humulin to our patient. Thank you.